chat box, then we will just recheck if the audio is clear or not. So, yes, once again, welcome everybody, all the participants to the session of Healthy Living with Thyroid with our expert health consultant, Sapna. So, me and Sapna both welcome you all to this session. And now I would like Sapna to just come and start her magic, all over again. Over to you, Sapna.
Nothing magic, Jasleen. Very good evening to all my participants for this session today. Myself, Sapna, we have taken a lot of sessions and you must have participated in a lot of my sessions also. So today on High Demand, we are coming up with this session on thyroid, which is healthy living with thyroid. Okay. That means we are not trying to treat thyroid. We are just trying to take care of the problems that are associated with thyroid, and somewhere on the way it may help us to boost the thyroid functions also. And again, today I'm majorly talking about hypothyroidism. Why hypothyroidism? Because it affects a large count of population, because that is the most common one. When we talk about hyperthyroidism, the incidences are quite less, and that requires a lot of medical and surgical intervention, and we can't do much about it through our supplementation. So that's why I'm basically talking about hypothyroidism today. All right. So to understand the hypothyroidism, first we have to understand that what is actually a thyroid. Okay. So thyroid, as you can see in the slide, you can see in the picture that thyroid gland is a butterfly shaped gland located in the base of your neck. That means it is present in front and it is located at the base of your neck. Okay. It is basically a part of your endocrine system. Okay. It basically is a part of our endocrine system. And what is endocrine system? All the hormones which are there in our body, secreted, regulated, that comes under endocrine system. So since thyroid also releases hormones, that's why it is also a part of endocrine system. And it releases hormones. It releases very important hormones which impacts each and every cell and each and every system of ours. Okay, so if you want to understand, it basically helps us to regulate our metabolism. It has an impact on your breathing, it has an impact on your heart rate, it has an impact on your nervous system, it has an impact on your body weight, it has an impact on your muscles, it has an impact on your menstrual cycle, it has an impact on your body temperature regulation also, and it has an impact on your cholesterol levels also. So you can see, and the list goes on. These are very few things that I'm talking about. So it impacts each and every system of yours. So imagine how much important it is for us to take care of our thyroid, to take care of our of all these problems also. Okay. So now you're able to understand, you're able to imagine now that where can be our thyroid gland. So you must have seen doctors also, when you go and visit the doctor and you tell something related to your throat, they palpate, they touch and see that yes, all is good or not. So somewhere they are also seeing that whether you have a swollen thyroid gland or not, right? So they check it that way also. Okay. So in the next slide we'll be understanding that what is hypothyroidism. So hypothyroidism is a problem related to your thyroid gland. Hypo means less, and thyroidism means problems related to your thyroid gland. That means it is a condition where your thyroid gland becomes underactive. That means it is not able to produce enough thyroid hormone to meet out your body's requirement. Okay, so basically hypothyroidism is an underactive thyroid condition in which your thyroid gland is not able to produce enough thyroid hormones, which affects your metabolism and all your systemic functions. Okay, so you can see how much globally, almost so many people, like almost 200 people, 200 million people have some form of thyroid disorder, right? And in newborns also, while delivering and all, sometimes because of the damage, or sometimes the thyroid gland itself is not formed only, and that's why in newborns also there can be a thyroid condition, right? So hypothyroidism, I hope everyone has understood. So basically this thyroid hormone, you have to understand it, that it contributes 60% of your metabolism and your daily calorie burn. So imagine if your thyroid is not functioning well, how much problem it can put an impact on your metabolism and your daily calorie burn. And that's why one of the main features of hypothyroidism is your weight gain, because your 60% of your metabolism drops down, right? And you're not able to burn the calorie as per your requirement to maintain a healthy weight. Okay. So now we'll move on to the next slide, where it is important for us to understand a bit that how this thyroid hormone is produced and released. Okay. And our body is very intelligent. So depending on the levels of these thyroid hormones, it automatically gives signal, and it balances out the levels of your thyroid hormones in your blood. So if you can see, uh, in your schematic diagram, you can see that what happens exactly. First, your hypothalamus becomes activated because of the levels of your T4 and T3, because of your levels of thyroid hormones in the blood. It triggers your hypothalamus. Hypothalamus is what? It is a part of your brain. Okay. So your hypothalamus gets triggered, and what it does, it releases a thyrotropin releasing hormone. Okay, it releases a hormone called thyrotropin releasing hormone. Okay, then this thyrotropin releasing hormone, what it does, it basically activates and stimulates your pituitary gland. Pituitary gland is also a part of our endocrine system. Pituitary gland is also present in your brain only. So so this TRH, that is your thyrotropin releasing hormone, stimulates your pituitary gland. And then once the pituitary gland is stimulated, what it does, it releases your thyroid stimulating hormone, which is in small form known as TSH also. You must have seen on the blood reports, it is shown as TSH, right? So this is the same TSH, thyroid stimulating hormone. Now this thyroid stimulating hormone further stimulates your thyroid gland, and in the presence of iodine and in the presence of an essential amino acid called tyrosine, it makes two hormones, T4 and T3. Okay, it makes two hormones, T4 and T3. T4 is the inactive form and T3 is the active form, right? So thyroid gland, when it releases these two hormones, 80% is your T4 and 20% is your active form in the form of T3. And when it further goes to the tissues and all, what happens? T4 transforms itself to the active form, that is your T3. Okay. So what happens? Your hypothalamus releases your thyrotropin releasing hormone. It stimulates your pituitary gland. Pituitary gland releases your thyroid stimulating hormone. Your TSH stimulates your thyroid gland, and it releases two hormones, T4 and T3. T4 is inactive, T3 is active form. Okay. Now, these T4 and T3, the presence of these T4 and T3 hormones in the blood levels actually gives positive and negative feedback. Okay. So if your blood levels are optimal for your T4 and T3, that is your thyroid hormones, what it does, it gives a negative feedback to hypothalamus and pituitary, that no need to release further hormone because the level is fine. But at the same time, what happens if the T3 and T4 levels is low in your blood, it gives a positive feedback to your hypothalamus and pituitary gland, that now you need to release TSH so that the thyroid gland can release more thyroid hormones, right? So your optimal level gives a negative feedback to your hypothalamus and pituitary, and your lower level gives a positive feedback that now you need to release more hormone to maintain a optimal level of thyroid hormones in the blood, right? So now if any condition, imagine your thyroid gland is not able to function well because of any condition, what will happen? It will not be able to release good amount of T4 and T3. right? So the level of T4, T3 will be less. When the level of T4, T3 will be less, what will happen? It will stimulate the pituitary gland to release more TSH. Okay? Because it's a positive feedback it is giving, right? So that's why in the blood report, what happens when you check for hypothyroid, your TSH levels are high and your T3, T4 levels are low because of all the calculation happening here in this schematic diagram. I hope everyone has understood this clearly, right? So thyroid gland releases your T3, T4. If the level is low, it stimulates your pituitary gland to release more TSH so that the thyroid gland releases more T3, T4. So that's why in a blood report, your TSH level comes higher and your T3, T4 level comes lower. So here again with the arrow, it has been seen that pituitary releases your TSH. TSH stimulates your thyroid and your thyroid releases your T3 and T4. Okay, right? So let's move on to the next slide. So that T3, T4 level you'll be able to understand in our coming slides. We have a normal levels also. Okay, so after understanding the formation of thyroid hormone, we will move on to types of hypothyroidism, which is again based on the same mechanism only, right? So types of hypothyroidism are four types. Your first is your primary hypothyroidism, second is your secondary, third is your tertiary, and the fourth is your quaternary. Okay. Now, first primary hypothyroidism is of the main type. When it happens, when the problem is there in the thyroid gland itself. Okay. When the problem is there in the thyroid gland itself. Okay. And in that 90% of the time it is autoimmune reason. Okay, so that your immunity automatically attacks your own thyroid gland, which hampers your thyroid function, and that's why your thyroid hormones are not forming properly. Okay. Earlier, there used to be one more reason, that is iodine deficiency. But now, these days, all our salts and everything is fortified with iodine. So, that deficiency is not anymore. That reason is not anymore there. But in other developing countries, still it is one of the primary causes of hypothyroidism. Okay. Now comes the second type, that is your secondary. Now, secondary, when there is a problem in the pituitary gland, when there is a problem in the pituitary gland, which releases your TSH. So, pituitary gland, what problems can be? It can be because of any tumor, any kind of cancer, any kind of therapy that has been done related to your brain. So, that time your pituitary gland can be having some problem, resulting into the secondary hypothyroidism. Tertiary, when there is a problem in hypothalamus, the first part of our brain. When there's a problem in hypothalamus, then it is called as tertiary. And the last is your quaternary, when the tissues are not that much responsive. Your cells, your tissues of your body are not able to respond well towards this thyroid hormone, that is called as quaternary. Okay, but mainly we'll be talking about primary hypothyroidism, that is autoimmune hypothyroidism, because that is the major thing happening in the large population. Okay, so four types: primary, secondary, tertiary, quaternary. Primary, the problem in the thyroid gland itself. Secondary, the problem in the pituitary. Tertiary, the problem in the hypothalamus. And quaternary, when the cells are not able to respond to thyroid hormone itself. There's no other problem in the whole pathway, only the cells are not responsive enough. Okay. Now, understanding the types of hypothyroidism, we should also understand some risk factors affecting hypothyroidism. Okay, so we'll move on to the next slide. So first is your gender and genetics. So females are more prone to having this hypothyroidism as compared to males. Okay, as compared to males, females are more prone to have hypothyroidism. If there is any kind of radiation therapy near your neck, so because of any other disease, you must have undergone a radiation therapy around your neck, so it may make your thyroid gland a bit underactive. Okay, Genetics also one of the reason. Gender genetics. If your family has a history of hypothyroidism, you are always at a risk of getting hypothyroidism, and that's why keep on checking on a yearly basis, so that you are well aware and well notified that yes, the when the problem has actually started. Okay, rather than waiting for the symptoms to come and then suggest that yes, you have already affected by hypothyroidism. Okay. Third is your history of any autoimmune disorder, because as I said that this hypothyroidism, the major reason these days is autoimmunity. So if you already have autoimmune disorder, maybe like rheumatoid arthritis, or you are having a celiac disease or something like that, so then that means your immunity is already compromised, right? And that's why there are chances that you may get a problem of hypothyroidism also. Okay. Treatment of hyperthyroidism also sometimes leads to this problem, hypothyroid. Why? Because in hypothyroidism, your gland is very much active, and you have to make it underactive, right? Through surgical intervention or medical or radiation therapy or any kind of chemical things. So to make it underactive, to sort out this problem of hyperthyroidism, you may end up having a hypothyroidism condition as well. Okay. And the fifth point is your drugs and medication. So there are certain drugs and medication like your medicines, very easily available. Your cough medicines, your prolonged intake of diabetic medication may have a risk factor of developing a hypothyroidism. Okay. So, after understanding the factors, it's important for us to understand your symptoms also, the symptoms of hypothyroidism. So, in the picture, you are able to see that overall, from head to toe, it is actually affecting all your systems. It's affecting your nerve system, your lungs, your heart, your digestive system, your reproductive system, your bones, your muscles, everything. So imagine the importance of this thyroid hormone in your body. Okay. So you are able to see in the slide that if we start from head to toe, it basically gives you problems in concentration. Sometimes you will see that you will see brain fogging. You're not able to analyze the things in a much more better way. Okay. It will lead to depression also. Okay. You will start feeling some forgetfulness kind of thing, that I'm these days I'm not able to remember things in a better way as I used to be earlier, right? You will start feeling a lot of mood swings. Suddenly you will be very agitated, suddenly you will be very depressed. All these symptoms you will be able to see, and these are all nervous system related. Okay. Then if you see, you will be able to see a lot of hair fall, brittle hair, nails, right? So you'll be able to see all these symptoms. Then coming down your face, you'll start seeing a lot of swelling on your face, especially when you get up in the morning. It happens because of a lot of water tension happening in your body, because a lot of sodium and potassium mechanism happening in the body. So that's why you tend to retain a lot of water in your body. Okay. You may see a swollen gland also, because your thyroid is functioning much more at a higher rate to meet out the requirements of your body for the thyroid hormone. So you may see a swelling also in long run. Then you may see a hoarseness. You will see a very rough voice. The people who are having a thyroid, in few people, it's not applicable on everyone. So all these symptoms, few may be present in one, few may be present in other, all may be present in one. So it differs from person to person. You will see a lot of constipation or digestion related issues. You will see your heart rate is now very, you will see a slow heart rate. You will not be able to feel that uh, like pumping kind of thing. No, you'll see some palpitation kind, not palpitation, I'll say very slow heart rate. You'll be able to feel that I'm not able to feel that energy in my heart. Okay. You'll start feeling a lot of weight gain and fluid retention. That is definitely one of the very common features of hypothyroidism. In reproductive system, you may see menstrual problems, menstrual irregularities, as well as in long run it may lead to infertility also. That's why they say that when you're pregnant, they check on your thyroid hormones also for a safer pregnancy. Okay, if you have a family history, if you have developed it recently, that time you will see a lot of letharginess, a lot of low energy, and a continuous kind of unrest, a fatigue you will be able to see. You will see a lot of joint pain, muscle pain, right? So that way, these are the main symptoms that you'll be able to see: muscle cramps, dry skin. All these are the symptoms of your hypothyroidism. Okay, so now you are able to see that it's affecting from your head to toe. Okay, so now we'll move on to the next slide, and there you will be able to see the normal levels. And why I have added this, because when you're reading your blood reports, you should be able to understand that which one is better. Like if your TSH levels is towards on the lesser side, you are in a better condition. Having thyroid also, you are having a better level. Okay, you are having a healthy level, you can say. So TSH, if it is lying between from zero point 0.5 to 2.5, that is below 3, that means you are having a healthy levels of TSH. And your T4 and T3 should be on the higher side. Okay, because this is the available thyroid hormones in the blood, right? So if it is on the higher side, that means it's good for you, right? So between 1.3 to 2.8 of T4, and on 3.2 to 4.2 if it is for T3, that means you are having healthy levels of T4 and T3. So TSH should be on the towards the lower range, and your T4, T3 should be towards the higher range. Okay, that's the way you need to understand your blood reports, right? Generally we focus mainly on the TSH. So now you are able to understand that importance of T4 and T3 present. That means this is the available thyroid hormone in the blood, right? So if it is towards the higher side, that means the thyroid gland is still functioning better. Okay, so then now from normal level, we'll move on to the next slide, which will be related to your nutritional tips. Okay. Now this time we have divided this nutritional tips to two parts. First is your don'ts, because there are certain things which you should not be doing when you're having already a hypothyroid condition, or you have a history of hypothyroid in your family where you are at a risk of getting this problem. Okay, now first, very controversial all the time for all our ABOs as well as the clients or the customers we face. So y- so you can clearly see it is soya which is genetically modified. Okay, see, because the demand these days is so much, you are seeing everywhere your soya sauce in your like Chinese cuisine, in your Thai cuisine, in all your sauces, all your tofu, all your soya bean oil. All these are so much highly available, right? It is so much highly available. So the risks are higher that somewhere these all crops are made by genetically modified seeds or plants, right? The chances are very, very high. That's why it is important that you try avoiding the soya based products, especially the soya sauce, which are very very cheap and very definitely they are made from the genetically modified seeds and plants. So your tofu, your soya milk, your soya bean dal, your soya atta, that you have to slightly I'll not say completely avoid it. You can use it, but in moderation, especially when you're making it in cooked form. Okay, highly cooked form. And that's why our all plant protein powder stands aside, because we use non genetically modified soya to process our all plant protein powder. And also in this making and in this processing of our all plant protein powder, it is completely devoid of all the goitrogens which is present in the plant or the seed itself. Okay, so that's why all plant protein powder is anyway safe for a hypothyroid person also to consume. But only prevention you can, if you want to take it, you can just maintain a gap between your thyroid medication and the intake of your all plant protein powder, just to be on the more safer side. Okay. Second, gluten. For some people, gluten can be a culprit, not for everyone, I'll say. Because as I said, that because of this all autoimmune disorder, what happens, the people who are suffering from thyroid, they may develop a disease of digestive system also, which is called as celiac disease, or they can suffer with some huge constipation, something like that. So for those people, if nothing is working out, you can slightly avoid gluten intake on a very high level. So you can slightly reduce the intake of gluten, or maybe you can go completely go gluten free also, just to take care of the digestive complaints. If you're not having such digestive complaints, you can still go on with the gluten. Third is your raw cruciferous vegetables. Cruciferous is a family, cruciferi, which is called as the cabbage family, the mustard family. Okay. So all the vegetables like your broccoli, your cauliflower, your cabbage, your turnips, your mustard greens, these are your cruciferous vegetables. Why it has to be avoided? Because it is having goitrogens. Goitrogens is a compound which inhibits the absorption of your thyroid hormone. Okay. But if you see all these vegetables, these are mostly used in the form of salad in the raw form. But the same cruciferous vegetables, if you're cooking it properly, the goitrogen compounds gets deactivated, and you can still enjoy these vegetables with the goodness of vitamins and minerals present. Okay. So that's why you can enjoy, but try to completely avoid the raw vegetables. All your cauliflower, cabbage, mustard greens, your turnips, radishes, these are all cruciferous vegetables. Broccoli, right? But if you cook it properly, the goitrogens become deactivated and you can still enjoy it. But again, moderation is the key. You cannot have it in huge quantity since you have cooked it. Try to have it in moderation only. Try to have it in limit only. Now, fourth point is caffeine. So the people who are into much of coffee and coffee intake, they should be slightly be careful if they are also suffering from hypothyroid, because caffeine blocks the absorption of your thyroid medication. So the people who take your thyroid medication and after 30 minutes of gap they are taking caffeine, they should be more careful. Try to maintain a gap of at least 2 hours between having your thyroid medication and having a coffee. Okay. Fifth is your sugar and processed food. So we all know now the worst part is your sugar and refined food, because what it does, it basically, these are precursor of your inflammation. Okay. And a continued inflammation, what it leads to, it leads to a compromised immunity. When it leads to a compromised immunity, then definitely in long run it will worsen the condition of your hypothyroid. It will worsen the condition of your thyroid gland. Okay. Now, the sixth is important, fruits. There are certain fruits that you should be slightly avoiding, especially when you're already having a condition of hypothyroid. Strawberries, pears, and peaches. Strawberries, pears, and peaches. That you should definitely be avoiding. And the lastly, vegetable oils. Vegetable oils, basically, especially all your soya bean oil, your sunflower oil, these again are, because the demand is so much, they cannot meet the demands by following the proper crop regime. They have to go for genetically modified seeds and plants, then only they can meet these demands, right? So vegetable oils, basically what it does, it blocks the thyroid hormone transport and utilization. So the people who are already having a hypothyroid condition definitely should be using these oils to the minimal, or if possible try to avoid it completely. Okay. Peanuts, somewhere try to use it in moderation, the people who are having hypothyroid. And out of millets, it is said that it has a slightly negative impact on your hypothyroid. But out of all millets, definitely try to avoid the pearl millet, that is your bajra. Okay. Try to avoid that millet if you're already having a condition of hypothyroid. Okay. Now we'll move on to the next slide, which is your do's. Okay.
Sapna, Sapna, one second. Before we
Yes,
move,
yes,
there are people asking that what can they use instead of vegetable oils?
so they can go for coconut oil, mustard oil, ghee, olive oil. All these cold pressed oils are really good.
Okay, ठीक है. Yeah.
Okay. In fact, coconut oil is actually very good. I'll tell you in detail in my next slide. Yes. So hypothyroidism, you can see that there are certain vegetables and fruits that I've mentioned in this slide. So if you can see, I'll just put it in that way, the do's. So definitely keep a check on your weight. Okay. So keep a check on your weight. Why? Because it's seen that obese people may see improvement in thyroid function after a weight loss. Why? Because now the thyroid gland need not to work that extra, right? Need not to work that extra to support that extra weight, right? Secondly, exercise. So exercise is very important. I'll not go into that why exercise it is helpful for weight loss and all. It is important because patients on high thyroid medication who exercise 1 hour per day, okay, 1 hour per day, experience a reduction in TSH and improvement in T4 and T3. Okay, an improvement in T4 and T3, which is important. Okay. Now, intake of healthy fats. So you can see in the list, there are certain healthy fats, like you can see the avocado, you can see the fish, you can see the olive oil, right? These are healthy fats. Why? Because first of all, we all know now, with all our sessions earlier, that the base of all hormones is good fats, right? Out of that, mainly the coconut oil, olive oil, and omega 3 are actually very important for the thyroid functioning. Because first, coconut oil, while it is why it is important, because there is a compound called caprylic acid and lauric acid. Caprylic acid and lauric acid, which boosts the thyroid health and metabolism. Okay. Olive oil, it triggers your thyroid hormonal pathway. So olive oil is important bit because it actually stimulates your thyroid hormonal pathway. And omega 3, we all know it already has a thyroid boosting function, and it also improves on your metabolism. Okay. Second is your intake of protein. So intake of protein is also very, very important. So we have included fish here in terms of protein, but I'll also suggest that chicken is also a good source of protein if you're cooking in a healthy way. Why I'm mentioning specifically chicken? Because I told you that in the thyroid gland, there is an essential amino acid called tyrosine. Okay. And chicken is rich in tyrosine amino acid, which is important for your thyroid hormone production. Okay. So that's why intake of chicken, again, like once or twice in a week if you're taking, and anyway, if you're taking our all plant protein powder, you're already getting all the 9 essential amino acids, right? Now, fish also is a good source of protein because it's having good fats also. Again, helps you to improvise on your thyroid functions. Eggs are very, very important. Okay. Why eggs? Because it is a good source of your selenium and iodine. And iodine, as I said, in thyroid, it is important that iodine levels should be good. Okay. Right. So selenium and iodine presence in eggs makes it important source of protein, right? And the fifth is your curds, your prebiotics, right? Your prebiotics, your intake of good amount of your water, and your apple cider vinegar is also there, because it all helps you with the proper detoxification, making your gut more alkaline, which will help you to absorb all the nutrients in a much more better way. Okay. Right? So that's why your fiber rich food, your prebiotic like curd, probiotic like curds, fermented food, these actually helps you to improvise on your digestion, which is one of the most important like problem which you get when you're having this hypothyroid. Okay. Antioxidant rich food, because when you're having antioxidants, it is actually helping the thyroid gland to fight from the free radical damage. Okay. Because of this autoimmunity, because of all the inflammation process happening, your thyroid automatically undergoes a lot of free radical damage. So when you're going for all your lemons and limes, that is your vitamin C rich food, your tomatoes, right? These are all very good for your thyroid functioning. Okay. And the last is your use of anti-inflammatory spices. That is your spices like your cinnamon, your ginger, your garlic, your chamomile, your turmeric. These are all very good anti-inflammatory, which will again help you to improvise on your thyroid functioning, right? So I think I have all covered your fermented foods, your good sources of fat. Your avocado is also good sources of fat, and also very rich in your antioxidants, right? So this was all about the nutritional tips that should be doing do's. And Jasleen has come up with a very nice thyroid boosting juice. So if you see apple, it has to be taken as one apple, half cup pineapple, half beetroot, and stalks of celery. Now, if you ask about celery, celery is having a very powerful electrolytes and also helps in boosting T3 level. Okay, so celery helps you in that way. Beetroot again has very high antioxidant, and in a study in rats, in a study in rats, it's been seen that the rats, when fed with pineapple juice, it has actually improved the T3 and T4 levels. Okay, in rats there was a study there. So that's why pineapple also helps in the thyroid functioning. And apple because it acts as a detoxifying agent, and also rich in vitamin A, vitamin C, which is again antioxidant. So that's why if you go for this, you can definitely suggest all these this thyroid boosting juice to your clients who are facing this problem. Okay, so now we'll move on to the next slide, which is the most important part, the supplementation part. Okay, so if you see the supplementation part, Justine will move on to the next slide. So here it is a gist of essential nutrients required for hypothyroidism. In overall, if you see, surprisingly, it takes 13 nutrients for the creation and conversion of thyroid hormone. So 13 nutrients are actually important. Okay, so this is just a gist that what are those nutrients. So vitamin A, your B complex, your minerals like magnesium, zinc, and selenium, your good fats like your omega-3, right? Your vitamin C, your tyrosine, which is amino acids. So overall, these nutrients are actually required for the functioning and the making of the thyroid hormone. Now we'll move on to our own supplements, our own Neutralite supplements, that how it is going to help you. Okay, so we'll move on. First is our all plant protein powder. So we all know that all plant protein powder is having 9 essential amino acid, and out of that one is your tyrosine also, which is important for the formation of your thyroid hormones. Okay, and also if your body is not having sufficient amount of protein, it also is important for the transportation of thyroid hormones, right? So that's why protein requirement of your body is important, and that's why you should be upping your protein intake from 10 to 30% of your total calorie intake if you're having hypothyroidism. Okay, and overall we all know now that all plant protein is helpful in your weight check, your muscle fatigue, your tiredness, you're boosting your metabolism, right? And is a great food for all your cells and tissues. So that way your all plant protein powder is helping you out. Okay, and why it can be taken safely in hypothyroid also, because the goitrogens have been removed while the making of the all plant protein powder. But again, to be on the safer side, maintain a gap of 4 hours between the thyroid medication and taking of your protein powder. Second is your daily there are so many vitamins and minerals present, like 13 vitamins and 11 minerals. Out of that, 4 are really important for the thyroid functioning. First is your zinc. Zinc is majorly required for the conversion of T4 to T3. That means from inactive form to active form, zinc is majorly required. It also has results in lowering the TSH levels, and the hair fall that you see because of this hypothyroid condition. It also helps in the hair fall problem also. We all know zinc is important for hair fall, right? Second is your selenium. It's a like wonderful mineral. It basically improves the level of anti-thyroid antibodies. As I suggested earlier, it's an autoimmune disorder where your body creates antibodies against your own thyroid gland. So what it does, it improves the level of anti-thyroid antibodies, okay, which counters those antibodies, right? Understood? And because of its antioxidant effect also, it protects the gland from the free radical damage. Okay. Now comes iodine. We know without iodine, there is no formation of T4 and T3 only, right? There's no formation of thyroid hormones only if there's a iodine deficiency. And magnesium, it is also seen that low magnesium causes a decrease in T4 levels also. Okay, low magnesium level causes a decrease in T4 levels also. How will you know about magnesium deficiency? If you are craving for a lot of chocolates, sweets, so that is a denotion that yes, you may have a magnesium deficiency. And last is omega. Need not to tell much. It helps in boosting your metabolism, and it also helps in your thyroid functioning. Okay. The next slide will tell us about two more supplements which help with your thyroid function. Okay, so we'll move on to the next slide. That will be having a ashwagandha first. Okay, so ashwagandha is actually very, very important. We all know the importance of ashwagandha from ancient times. It is a valued adaptogen. Okay, valued adaptogen, that means it works on your stress, it works on your cortisol levels. Okay, and cortisol again is indirectly related to your thyroid functioning, right? So it basically helps you to improve your thyroid function. It relieves your adrenal fatigue. Adrenal fatigue is nothing, it is to reduce on your stress hormone. Okay, it combats on your stress and anxiety, it gives you a good sleep, it improves your depression. All these symptoms are related to your thyroid also. Okay, so ashwagandha is basically balancing your cortisol and thyroid hormone. So in a study, in a 8-week study in 50 people, when I was like looking for importance of ashwagandha, I came out to this study. It was a 8-week study in 50 people, which showed an improvement of T3 by 41.5% when they were given ashwagandha for 8 weeks. T3 was improved by 41.5%, T4 was improved by 19.6%, and TSH was decreased by 17.5%. Okay, so that's why ashwagandha is also a very crucial supplement that has to be added in hypothyroid. And in the next slide, we'll again see there are two more supplements which helps you with your thyroid functioning. So Jasleen will move on to the next slide. That is your natural B and multi-keratin. Okay, so natural B, we all know in hypothyroid what happens, your metabolism slows down, and natural B actually helps you with your metabolism. Okay, your natural B helps with your metabolism, and also it improves the cell response to your thyroid hormone. It improves the cell response to your thyroid hormones. And it is also seen that 40% of your hypothyroid, the people who are having hypothyroid, also face a vitamin B12 deficiency. So basically what it does, natural B, it works with the thyroid medication synergistically and improves your metabolism and your other functions. Okay, so it improves your cell response to your thyroid hormones, and it also helps you in improving your metabolism. And the next is your multi-keratin. Very, very unknown but very important, because vitamin A supplementation, if you're giving for 4 months, it has significantly reduced the levels of TSH. There was a study in which they gave the vitamin A supplementation for 4 months, and they saw a reduction in TSH levels. It also has a positive effect on T3 levels. Okay, so these were the two main apart from the first four. And the last, there are few other. In the next slide we'll be able to see. So in the next slide we are able to see, Jasleen will move on to the next slide. So in the next slide, there is natural C. Natural C, again, it prevents the thyroid from the free radical damage because of its high antioxidant property. AVH and fiber, because the person who is facing a lot of digestive complaints because of this hypothyroid, depending on the complaint, if a person is having a lot of constipation, you can give a AVH. If a person is having a lot of indigestion, a bloating kind of thing, you can definitely suggest a fiber and AVH combination also. AVH is your amla ki, vipit ki, harit ki. Okay, and the last is your CalMag D plus. Why CalMACD plus? Because this thyroid hormone also interferes with your calcium metabolism. So the people who are having hypothyroid also have a chance that their calcium levels also will be on the lesser side. That's why add a calcium to your daily routine apart from your all the other supplementation for the people who are having hypothyroid. And also vitamin D also has shown improvement in TSH and your low calcium levels. Okay, that's why it is important that if you can add CalMACD plus also additionally for the hypothyroid people. Okay, now if you ask me priority wise, protein, daily omega, natural B, and ashwagandha. Okay, the next one or two supplements depends on the complaint of the person. So that way you can suggest, and overall you can suggest a weight management program also, because the main feature of hypothyroid is also weight related. So additional to all these supplementation, plus minus, you can suggest the weight management program also, because weight management program, protein, daily omega, natural B, anyway we suggest, right? And for the detoxification we suggest AVH. Additional to that you can suggest a body key shake also, right? So this was all from my side. I hope I was clear in explaining all the slides, and hopefully it will be helpful for you whenever you're talking to a hypothyroid client, or whenever you have a customer like that. It will be helpful for you to suggest the line of supplementation and the diet and the tips that I've suggested. Okay, so all from my side.
Yeah, Sapna, all from your side अभी नहीं बोल सकते हो. There are so many questions. मुझे तो I think I am not able to even see all the questions. So that
So
is
what we'll
the
do is we'll do a hypothyroid question session only.
yeah, I think that is good. But yes, one thing which we always repeat here, we are not giving any particular individual consultation. Please get in touch with your respective state health consultants, because now recently, actually speaking, Sapna has also been getting a lot of queries. So first, I request you to get in touch with your state health consultant. And in case if your answer is not, if you don't get answers still, then you can get in touch with me or Sapna, and then we'll definitely help you out. There are a lot of people actually messaging. Let me see. Coconut oil and olive oil, are they not vegetable oils?
See, vegetables, see, they cannot be genetically modified, right? And coconut oil has a particular effect of lauric acid and caprylic acid, which actually helps you to boost the thyroid function. Okay.
Okay.
And yes, olive oil again is very matlab, is a very refined form and is rich in omega 3 fatty acids, which again helps you with the boosting of your thyroid function. Vegetable oils on the on the other hand, it actually negatively affects your thyroid. That's my point. It's not about only vegetable oils, it's about the right quality of oil. That was my point of telling about the oil.
ठीक है, ठीक है. Also, yes, somebody is asking here for hyperthyroidism. So, Sapna, can you tell them that not
See,
possible?
hyperthyroidism, as I suggested, that the incidences are very low, and hyperthyroidism actually requires a very immediate response in terms of medication or in terms of medical intervention. Hypothyroid is a very safe condition comparative to hyperthyroidism. That's why I've not taken hyperthyroidism, because we cannot do much about it through supplementation. There's no particular line of supplementation which we can give for hyperthyroidism, right? So in hyperthyroidism there's a lot of heavy bleeding is there, so that time we can suggest a cherry iron. But actually, unless and until you're correcting the hyperthyroidism, the bleeding will not stop. We are just able to correct, will not be able to even correct the hemoglobin. So that's why I opted for a hypothyroidism mainly, because a large population is affected by hypothyroidism only, and we can actually take better care of hypothyroidism.
Okay. Yeah. So, Chamundi is asking egg and fish ke replacement mein what can we give for vegetarians? And also Arpita is asking if celery is not available, is there any
Yeah,
substitute?
so see, that is just a juice thing. It's not that you have to use a celery only. So other components are also there which are helpful in the thyroid functioning. So if celery is not available, you can use the remaining three. You can use the carrot, apple, your beetroot, and your other pineapple. So that way, no need to add a salary. Not like, matlab, it's not that you have to add a salary only. I was just trying to mention that salary has a role in thyroid functioning.
Okay, I'm just taking two more questions right now. I know we are hurrying up because there is actually another event which is starting sharp at 6. So I'll just put my number here on the chat box in case if your questions are not answered, you can ping me on my WhatsApp. I'll help you. Also, yes, definitely, I would like to tell all of you that Sapna is doing commendable job in preparing all of this. So your feedback also is highly appreciated. If you can let us know how the session went or what are the things we can improve for the next time, it'll be really good for me and for Sapna. I know many people have not been able to attend the session. Sapna, can you beat? There are many people who still want to attend. So yes, there is no recording for this session. Please do not ask us for the recording. We will repeat this session soon, maybe next month, and we'll see. If you have any idea, let us know what else should we add or what else maybe you think was not that good. We can remove that also.
So quickly, I'll tell that how to read these thyroid levels. When TSH, your TSH level should be, if it is towards the lower side, toward the minimal side, that is good. But if your T4, T3 is towards the higher side, that is good. Okay, so no need to worry if your T4 and T3 is on the higher side, right? That is the presence of thyroid hormones in the blood that is available in the blood, right? So that's why it is good if your T4 and T3 is on the higher side and TSH is on the lesser side. That's what is showing, that better if it is between 0.5 to 2.5, and T4 is better when it is on the higher side, and T3 is also better when it is towards the higher side. That's the way you have to read this.
Perfect, perfect. So that's it. I'm really sorry. We have to stop now because there's another session starting soon. But yes, you have my number on the chat box. I have given my WhatsApp number. Sapna, you should definitely take out one time, fatafat, read the chat box. There are many people who are actually thanking you for the amazing presentation. So that's it from my side and from Sapna's side. Anything you would like to say, Sapna?
Thank you for being so patient and try and understanding this. Actually, it was a very controversial topic and a very a big topic also. I tried my level best to make it more simple and make you understand. I hope I was able to do my job. If not, we'll try to do better job in our next session. And thank you for being so patient and listening to me for